Thank you for joining me today, Dr. Russell.
It is my pleasure, Vicki.
Can we talk a little bit about our goals towards the path to reopening? How far are we at this point from reaching the 75% of eligible New Brunswickers having had their first dose of a vaccine?
Well, we are now at 72.8%, so we're getting closer. We're getting closer.
What have been some of the most effective efforts of public health this week to make getting the vaccine more accessible for New Brunswickers, be it school clinics or drop-in clinics, or even working with businesses to coordinate an on-site clinic?
Well, all of those things have been happening. We're definitely trying to think outside the box and be creative about how to help people get their vaccine, because there are some barriers for some people. So we want people, I actually just went through my phone today and texted all of my acquaintances and asked them directly, have you had your vaccine? And most of them said yes. And one of them said no. And I asked why, and they said they were afraid of the vaccine, they were afraid of the side effects of the vaccine, and they were afraid of needles.
Okay.
So I offered to book them in. I offered to let them know. I let them know that at the vaccine clinics, they actually have spaces where the people that are woozy, around needles and things can have a little private space away from everybody else to be able to get their vaccine comfortably. And so I think every resident in New Brunswick really needs to help their family and friends and colleagues get vaccinated, whether it's helping them with their online appointment, helping them get a ride there, or having a sit-down conversation about the benefits of getting vaccinated. We know right now, for instance, in Charlotte County, there's lots of residents there who have family across the border, and we know that they would love to go see them. And residents, as you know, Patty Hadju, the federal minister, unveiled a plan around easing some restrictions for travel of fully vaccinated Canadians and permanent residents. They'll have to get a COVID-19 test on arrival and have an isolation plan, but they need to get vaccinated as well to be able to cross the border to see their friends and family. So, there are lots of incentives right now for getting vaccinated. And I think the most important thing that people need to realize is that we in New Brunswick have been so privileged and so, I want to say blessed, but certainly we have worked extraordinarily hard and made many, many sacrifices to keep our numbers low and to keep our hospitalization rates low throughout the pandemic. But it came at a price, it came at a cost. And one of those costs was border measures and travel restrictions. Mm-hmm. Once we start opening up our borders and once we start easing travel restrictions, we will be back to pre-pandemic travel, which had been reduced by 80%. So if you do the math, that means borders are going to open, travel restrictions are going to be eased, which means there are going to be more travelers. More travelers means more cases. We expect there to be more cases. And the best protection about right now that we can give the population as these transitions happen is the vaccine. We know that the vaccine will help prevent transmission, and it's the best protection against ICU admission and death.
Obviously, just seeing the plan for the path towards green was inspiring for a lot of New Brunswickers to get the vaccine. What are you hearing from New Brunswickers about what's most appealing to them about the first phase of reopening?
Well, I think a lot of people have felt that hope, what you're talking about, being inspired, and I think a sense of relief as well in terms of feeling more protected with the vaccine rollout. Certainly the older populations, we've not really seen a challenge with respect to getting first doses or even getting the motivation and whatnot to get their second dose. I think as you go down through younger populations, there are some barriers, one being time. We know that young people don't necessarily have as much time in their hands. They could be working. One of the friends that I texted today to find out if they'd had a vaccine, they said they'd been working 7 days a week at their job for the last 2 months. And we're going to be doing that for the foreseeable future. So time can be a barrier, but we do have walk-in clinics planned where you don't have to have an appointment, and transportation can sometimes be a barrier. The fear of needles can be a barrier. And so we do have solutions for all of those things at this moment in time.
You mentioned the federal government announcing yesterday that it will change the requirement for a quarantine hotel for international travelers, Canadians coming back to Canada. what exactly does that mean for people who still don't quite understand, and how will that fit into New Brunswick's phase 2 of reopening that we hope to get to in July?
Well, Vicki, again, we are well on our way to reaching our targets for that time frame for sure, and all the details for that phase are online for people to be able to access. And I think again, we know that there are going to be more freedoms that people will have as we move through our vaccine rollout, but also as restrictions are eased. And I think that it's a positive thing in that, you know, we've been living through this pandemic collectively for the last 15 months or so, and people, again, they need that inspiration, they need that hope right now to get through to these next phases. But I think with respect to hotel isolation, yes, at the federal level, they're going to remove that requirement. As you know, in our rollout plan, we will be removing that requirement here as well at one point. So again, I think things will get easier and easier, but most of the things that are needed to make things easier are the cooperation of the public to get vaccinated, because we know that, again, our goal throughout the pandemic that we've succeeded at has been to keep our hospitalization rates low and to keep our hospital system from being overwhelmed. And once people have more freedom to travel and move around, we will see an increased number of cases, but most of the population will be protected if all goes well. If everybody gets their second dose and we get that 75% target with 2 doses, then we know that we can maintain our hospitalization rates as they have been. But for those people who aren't vaccinated, they will be at the highest risk. We know with the variants of concern, people can get more severe symptoms and require hospitalization and ICU admission. And we've been really almost immune, excuse the pun, we've almost been immune to that because our numbers have been so low. But again, this is a transition period, and people do need to understand that as we go through this transition period, the risks are going to be higher. In fact, I was reading on the internet, on Twitter, there was a tweet about the risks, and it is quite true that compared to a year ago at this time, the risks of moving into the summer, let's say summertime last year versus summertime this year, number of cases across the country were extremely low. So the risk of importation of cases to New Brunswick through travel was extremely low, and the risk of getting COVID was low. The risk of getting COVID into this summer will actually be higher unless you're vaccinated, obviously, because again, there will be more travelers, there will be more people moving around, and with the variants of concern, we know that there are resurgences and outbreaks in places because of those variants, and that is what we have to keep our eye on.
Mm-hmm. I wonder if you have some concern with the fact that because New Brunswick has done so well, we don't necessarily have a natural herd immunity as a place would that maybe had more cases. Is that a concern here with people who aren't vaccinated going forward on the path to reopening?
Yeah, herd immunity is a tricky thing in the sense that, you know, we have seen evidence of people being infected a second time with COVID, especially with the variants. So you could have been infected with the wild type of COVID in the first wave or second wave, but now with the variants of concern, you could get reinfected with a variant of concern. And in fact, there is evidence that you can even be infected with 2 different variants at the same time in some cases. So again, the message is the best protection at this point in time are vaccines. So we have a great supply of vaccines. Obviously, at the beginning of the vaccine rollout, we had a very tough time with doses and supply because at the national level, we just didn't have them. Mm-hmm. So now we're coming into a period of time where we have many doses available. We have many clinics. We have pharmacies that are working with us, and kudos to them. They have been really and truly key to our success, along with the RHAs. Phenomenal work. I mean, again, collectively as a province, I cannot say enough about the work that's been done and that will be continuing to be done over the course of the summer. So I think that there could be a false sense of security, as you're alluding to, Vicki, and in terms of people feeling so protected throughout the pandemic that they might not be aware of the rising risks with increased travel and in the increase of variants that are the cases are surging in other places. So we have to really make sure that people understand that, yes, we've done so well thus far, but in order for us to maintain that success, vaccines are the key.
With our vaccine supply in mind, do you feel it will be easier to meet our second dose goals? How do you feel about that going forward?
Well, again, it's going to be a team effort. So with the doses and with the the immunizers and the public, if we're all working together in concert, then yes, we can achieve those goals. But there definitely has to be the enthusiasm, the willingness, the engagement, and all hands on deck. And again, as I said, I went through my phone and emailed, texted all of my friends to find out, because if you don't ask, you don't know. And you know, we had our steady 15 in our bubbles. Are your steady 15 going to be vaccinated? You should find out.
Oh, I really appreciate your time today. My final question is just, when we do hit this 75% goal number, how soon will phase 1 go into effect?
Oh, as soon as possible. I know that everybody is keen to see that first goal attained and really celebrate that first milestone.
All right. Well, thank you, Dr. Russell. Thank you for joining me today. Thank you for all you continue to do.
Thank you, Vicki.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.